Ever wondered why the word measles sends a chill down the spine of every health professional? Or why there's such an emphasis on getting vaccinated? Let's delve into the world of measles, a highly contagious disease that, despite being preventable, continues to pose a significant threat globally. Measles is a viral disease that spreads like wildfire. It's so contagious that if one person has it, up to 90% of the people close to that person who are not immune will also become infected. The virus lives in the mucus of the nose and throat of an infected child or adult. When they sneeze, cough, or even talk, tiny droplets containing the virus spray into the air. These droplets can land in other people's noses or throats when they breathe or put their fingers in their mouth or nose after touching an infected surface. Now, how does one know if they've contracted measles? Well, the initial symptoms, which appear about 10 to 12 days after infection, might seem quite ordinary. These include a high fever, a runny nose, bloodshot eyes, and tiny white spots on the inside of the mouth. However, a few days later, a rash develops, starting on the face and upper neck and gradually spreading downwards, a telltale sign of measles. Although measles may seem like a simple rash and fever, it can be deadly. Complications can include pneumonia, swelling of the brain, and even death. Children under 5 and adults over 20 are more likely to suffer from these severe complications. Now, the good news: measles is preventable thanks to the power of vaccines. Vaccination provides a remarkable 97% effectiveness against measles, with the administration of 2 doses. Since the introduction of the measles vaccine, we've seen a substantial decline in the number of cases and deaths. However, despite this success, measles outbreaks still occur, primarily where the virus is introduced by travelers from countries where measles is more common and where vaccination rates are not high enough to achieve what's known as herd immunity. Herd immunity is when a large portion of a community becomes immune to a disease, making the spread of this disease from person to person unlikely. This brings us to the importance of vaccination, not just for personal protection but to safeguard those around us too. Each unvaccinated person is a potential link in the chain of transmission. Breaking that chain requires high vaccination coverage. So the next time you hear about a measles alert or an emphasis on vaccination, remember, it's not just about you. It's about protecting everyone. Be a part of the solution, not the problem. Get vaccinated, break the chain, and let's make measles a thing of the past.